Dear friends, I'm very happy to be with you again from Baby Child and Co. We encourage you to subscribe to our channel because here we tell you a lot about the care of your babies and children. You can also follow us on Facebook. You can visit our blog at www.babychildandco.com and see a lot more things that we have for you. If you have already subscribed, thank you for subscribing. Do remember to tell a friend to tell a friend. Today we want to talk about the breathing of babies. So when a baby is born up to when the baby is an older child, the rate at which they breathe varies. A newborn baby breathes a little faster than a baby who is more than a month old. And again, they will breathe faster than a child who is 5 years and above, and so on and so forth. When newborn babies are breathing, the breathing is not the same throughout 1 minute. So what happens is that they breathe and then they pause a bit, and then they breathe and then they pause a bit. This is something that parents bring to my attention a lot, observant parents. But if you have noticed this, it is not unusual. That is the normal breathing pattern. But these pauses should not be too long. If the baby is a term baby, the pause should not be more than 15 to 20 seconds. And this pause should not be accompanied by a color change in the baby. So when the pause is prolonged and the baby's color changes, babies are usually pink, especially when you look at their mouth and their lips and their palms and soles of their feet, they are pink when they are newborns. So when these pauses are accompanied by this pink color becoming darkish in their mouth, their tongue, then that is a problem. So this pause, though normal, should not be accompanied by a color change. But definitely know that when your baby is breathing, a newborn baby, that baby will have some pauses in between the breathing. Another thing you may observe is noisy breathing. When you observe noisy breathing, sometimes it may just be because of something that has dried up in the child's nostril. So you can actually look in the child's nostril or put a wet towel, just wet towel a bit, and use it to rub the nostril. Not vigorously so that you can hurt your baby, because sometimes there's some piece of dried milk or mucus there, and then you hear a slight sound when the baby breathes. Noisy breathing that is loud and is persistent is a problem, and a doctor should be seen because of that. And when it is accompanied again by other symptoms like your baby is hot, is crying, is not feeding well, is coughing, then that is a problem as well. Sometimes you find that some babies have difficulty in breathing, and this is worse when they are breastfeeding. A baby should be able to breastfeed quietly. So when you see that your baby is struggling to breastfeed, then that is a problem as well, for which you should see the doctor. And when you see the chest wall going in and out as your baby is breathing, that is also a problem for which you should see the doctor. When babies breathe, you see the tummy moves in a little, in and out a little. But you definitely do not see the ribs going so up, so down, so inwards, and they are using their neck muscles, and it's like they are panting, they are making noise, and everything is so difficult. There's going in and coming out. Then that is a problem for which you should see a doctor. But otherwise, what is expected is this quiet, gentle breathing with pauses that are not longer than 15 to 20 seconds and not coming along with any color change. And that is perfectly normal for your baby. Whilst we are talking about breathing, we would also like to say that there may be some color change in your baby that is not accompanied by difficulty in breathing. And if you have noticed that as well, that is also a reason for which you should see a doctor, because that baby may be cyanosed. Sometimes babies are cyanosed because we call that peripheral cyanosis, because their feet and hands are cold, so you should cover them. But when you find that the tongue and the lips are also cyanosed, or they look dark, they no longer look pink, then that is a problem for which you should see a doctor so that your baby will be examined. Thank you for watching. do remember to subscribe and follow us on Facebook. Also visit babychildandco.com and tell a friend to tell a friend to subscribe to Baby Child and Co. Thank you.